At the top of this form is the demographic information. We're asking the student to include their name in this area, their clinical location, and if they're in a specialty area or spend the day in intensive care, include that information, such as Carter Healthcare ICU or Carolina East ICU or maybe a Vidant Pediatrics, and then obviously include an accurate date of their clinical day. And then we're asking the student to include the preceptor here. Of course, if you please review that to make sure the student has that information correct. In this next section, we're asking the students to include their assignment for the day, what procedures they may have performed, or topics that they discussed with their preceptor or maybe with a physician. And if possible, quantify these, such as 3 neb treatments, 2 blood gases, maybe they had a couple of patient ventilator assessments that they performed, and so forth. And then the observation area would be where the student would list things that they maybe didn't necessarily do, but they observed one of their classmates perform a blood gas, or they may have observed their preceptor or physician do a procedure. And again, quantify those if possible. This next section, we're asking the students to include their physician contact. If they did patient rounds with the physician or observed part of that, if they observed procedures that the patients had done by a physician or nurse practitioner, any physician extender falls within this physician contact category. And specialty areas here with the asterisk, if you'll give me just, I'm asking the student to give me a little bit of an explanation, such as code in the ER with the ER physician times 15 minutes, or perhaps a delivery in the OR with a twins for 30 minutes, or whatever. Just give me some details there. And then we ask the student to give us their most significant learning experience of the day. What stood out for them? What did they see that was beneficial or educational? And of course, sign their daily log that attest that that is what they did indeed perform or observe. And lastly, this section in the lower right hand corner of each daily log is a place that we're asking the preceptors to sign once they have reviewed things that the student documented for the day. And then separately, the preceptor should be completing an evaluation on each student, and the URL or the QR code, which is unique for each class, is located in this bottom right hand corner. This can be done on most any PC. It can be done on a smartphone. It can be done on an iPad. Should be adaptable to most any interface device. And the information on how to complete these I will post in a separate video. That concludes this video on reviewing daily logs, and thank you.